We know that individuals in rural and underserved communities and those with cultural and economic differences sometimes face barriers to their health. Things like food access, housing stability, transportation, education, and employment can have a significant impact on an individual's health. For these reasons, TennCare started the Health Starts initiative, and through this initiative, we are investing in the Community Health Worker Network in Tennessee. Community health workers, or CHWs, have shared life experiences with those they serve. They help provide resources and support to individuals to help improve their health outcomes. Additionally, community health workers meet individuals exactly where they are, whether that's in their jobs, at their homes, or even at their favorite park. They ensure that individuals have the support they need when they need it most.
Being a CHW, ultimately we're connecting our consumers with every single resources in the clinic. I may not be a therapist, but I can help by providing experience. I may not be a case manager, but I can walk alongside of you. I know what it was like having prepartum depression and how it felt to feel alone. But then when I had my baby, I was like, okay, I want to be there for someone else. They will never have to suffer with this thing by themselves.
It's shown to be that depression before pregnancy, during pregnancy, and after pregnancy.
Helping her conquer her postpartum depression, to get her out of the bed, to show her there is hope, there's a huge world to live in, to be the greatest you can be for yourself and for your children, and to actually see her do it. And she's ultimately making a better life for her and her children.
As a community health worker, we are there to listen to them, to say, okay, we're here. I can understand what are you going through. You have to be this kind of person to be able to serve people, impatient, and also with empathy to understand what they're going through.
I work specifically with the homeless population here in Nashville. This gentleman that I've worked with, he was chronically homeless for 7 years, and after working with him, he was housed. It's such a good thing because not only is he housed now and is responsible with taking care of his rent, he's so happy every time he goes and pays his rent bill. But he is also changing the way that he wants to live the world. I met with him last week and he said, hey, I'm gonna go to the program again. I don't want to relapse. And I was like, oh my God, you did that on your own. Like he called transportation, made sure there was a bed available. And I was like, Carrie, you're gonna be fine. And like I knew in my heart that he was gonna be fine. So I'm just happy that I was part of that.